Greetings. Earlier this week, I had to go to a doctor's appointment. I go to see a podiatrist because I have neuropathy in my feet. And so I go in there and I'm talking to the doctor, and I happen to mention that I'm having this problem with my left foot. And so we talk about it for a bit, and then he says, I think we need to schedule for you to have a nerve block. I had a nerve block last year when I had my shoulder done, but truthfully, it worked so well, I didn't remember it. But I guess this was going to be different than that. Basically, the idea was to try to ease the pain in the foot, numb a certain area of it, put on some kind of compression wrap, and then see how it goes over the next couple of weeks after that to see if everything is going to work out right. I'm thinking, wow, when I had that nerve block for my shoulder, luckily it was covered under no fault. New York State, you don't pay anything. No fault covers the entire thing. That's just your fault. So I decided, okay, I need to ask some questions. So I go up to the admin after the doctor has done his thing, and I make the appointment. Then I said to her, do you know how much this is going to cost me? And she said, well, no, I really don't know, but I think all you'll end up having to pay is your copay that you pay every time you come. Well, I have spent years on this channel and my other channel telling people that if you go to see a doctor, before you go, you should at least get some kind of idea of how much it's going to cost you. In this case, I've been seeing this guy for almost 10 years, so I wasn't worried about that visit feed, but I wanted to know about this nerve block. So she couldn't answer that question for me because I was doubting that all I was going to end up owing was going to be my copay. It didn't do me any good to ask her for a CPT code. Basically, that means procedure code, because she was a new admin. I know that because she wasn't there 6 months ago, which was the last time I saw him. So totally new, don't know how long she's been there. But if she didn't have any kind of idea of how much this thing was going to cost, then she wasn't going to know what the CPT code is. So I waited for a couple of days. Then I decided, you know what? I'm going to go ahead and call the insurance company. And my insurance company is a Blue Cross company. And the thing is that for outpatient services, they will usually have what's called a fee schedule. So they're based on, well, the same CPT code. And they have them out there. And so they can usually tell you what the prices are, or how much, they say they're going to pay. Sometimes they try to dodge you a little bit. And in this case, when I called Blue Cross and I got this lady on the phone, she was really nice. And I asked that question, okay, how much are you going to pay for a nerve block? And she said, well, I'm not really sure. It depends on this and it depends on this and depends on this. And I said, okay, I have the CPT code. She says, oh, you do? I said, yeah, I've done this for a while. So I give her the CPT code, and then she's gone for about 10 minutes. And then when she comes back, she says, well, it depends on if this is a tier 1, a tier 2, or a tier 3. This is totally new on me because I've never heard anything about a tier 1, tier 2, and tier 3. And I'm wondering, okay, well, tell me what these are because this is new. So she said, well, tier 1 are people who are physicians who do certain work, and they do it because they're part of a group. So for instance, if they work at the hospital, or if they work for a certain large physicians group and we have a contract with them, that's tier 1. Tier 2 are physicians who they don't really participate, but they will accept our payment as the payment in full. Tier 3 are physicians who are outside of our network, so whatever we pay them, you might be responsible for their entire balance. I said, well, how do we find out what my doctor is? So she says, well, give me the name and let's find out. So I give her the name, and she goes off again in another 5 minutes, so they can check that out. So then she gets back to me and says, well, he's a tier 2. So that would mean that probably whatever it comes to, you're going to owe, on basically the deductible. Because I have a plan right now where if it had been tier 1, my yearly deductible is $2,200. But because he's tier 2, the yearly deductible is $6,200. Neither one of those is making me feel all that good, but at least it's still better than tier 3. So I said, okay, so how much would you be paying regardless? She says, well, this is strange in the fact that the code you gave me is considered an inpatient code. I said, no, that doesn't make any sense. She said, well, that's what this is telling me that I'm looking at, this inpatient code. To which I said, well, I think that's incorrect. Maybe they're calling it that because the code is considered a surgical code. But the truth of the matter is, I had a nerve block last March in a surgical center, not an inpatient. And this guy here is in his office, not an inpatient. So that's not an inpatient code. That's not how CPT codes work. Now, I said that knowing that there are certain things, for instance, if you're going in to have a hip replacement or, knee replacement, or you're having screws put in your foot, a lot of times that is done on inpatients based on the severity of it, but not always. Some of those can be done in quality surgery centers. So she said, well, I'm not really sure how to answer that. I said, well, how about you call my physician's office? Talk to them. The way that the guy talked to me, this doesn't sound like something that he hasn't done before. She says, okay, I'll do that for you. So now I'm on hold for another 15 minutes. I don't mind being on hold because I don't know what my financial responsibility is, and I'm willing to wait to find out. And whenever I'm on the phone in the house, I walk. So I'm not on the phone often, but whenever I'm on the phone, I get my steps in. So it's about 15 minutes, and she gets back to me, and she says, oh, I got to speak to Jason. He's the nurse for your doctor. I said, well, yes, I know that. He's the only one. And I start thinking, that's right. He wasn't there at the desk when I asked this lady the question because he might have known that answer. So he said, no, this is done in an office. I said, well, yeah, okay, I knew that. I mentioned that. And he said that we usually charge somewhere around $100, $150. That's all that is. And I said, well, okay. To me, I said, that's more reasonable. Because, like I said, when I had the no fault, even though I didn't have to pay it, I got sent a bill anyhow, just to let me see it. And it was like $550. And if it was going to be that rate, I wasn't paying for it. I just deal with my issue. But around $150, they'll pay something on it. It's going to cost me a little less. Okay, I can handle that. But it was one of those kind of things where I tell people all the time to call and ask these questions, but I hadn't realized that there would be things like whether the doctors are network, in network or out of network. Usually I have worked with hospitals which are always in network, unless there's a contract dispute, which does happen from time to time. So I never really thought about the idea that it wouldn't be in network. Still, you need to at least have some kind of idea because, truthfully, if it hadn't been in network and it had been a tier 3, $550, I probably could have gotten on a payment plan with them to pay that down if I needed to. But I'd rather not have to deal with that kind of thing. So this is the reason why you ask questions. And the questions that you need to ask, if you can find out from the provider first, before you call the insurance company, is how much something's going to cost. What are you calling what it is that you're doing? And what's the CPT code? Those are the very important things. That's the information that you need so that when you call the insurance company, if you call the insurance company, you're going to sound like, I've put some time into this. And I wanted to ask some questions. You give them something that now they can look up. And truthfully, I think that that's just the way to go. Healthcare is one of those kind of weird things where, in this case, the admin had no idea. He had no idea where to go look for the price. She had no idea how my insurance company was going to cover it because maybe it's possible that they haven't had a nerve block since she's been there. Well, I didn't know how long she'd been there. Anytime within those last 6 months. Still, it's always better to know. No matter what kind of doctor you're going to see, no matter if you're going to the hospital for services, it's always better to have some kind of idea. So at least you're prepared for that. That's today's lesson. My name is Mitch Mitchell. If you have any questions about stuff like this, you let me know. Y'all take care.